introduced the Women's Heart Health Expansion Act, which would reauthorize the Wise Woman program at the CDC. That is still often not openly discussed, or even one that the general public is widely aware of, forcing women to suffer in silence.
Hey, everybody. This one is going to be too. So many women have to be their own advocates. Alsobrooks demands more women's health funding. And I know that's right. Misogyny, I talk about a lot. I appreciate women so much. I appreciate femininity so much. I don't think you should shy from feminism. I support my sister.
And now it's been worked out with the staff. So Senator Alsobrooks.
Thank you. Thank you so much, Mr. Chair, for holding this hearing today and for your commitment to working together to find common ground and advance bipartisan legislation. We have many common interests here, including a goal to lower prices for Americans, invest in life-saving research and research infrastructure, and protect Americans from public health threat, in part by protecting access to safe and effective vaccines. We're lucky to have a strong research and life sciences footprint in Maryland, and we want to continue to be on the forefront of innovation, developing cures for patients. I appreciate the opportunity today to highlight two bipartisan bills that will support life-saving research and frontline public health interventions. I know that many of us agree with the need to invest in more in women's health research. We have an obligation to our daughters to combat the conditions that leave women in crippling pain or at higher risk of chronic disease. That's why I'm proud to have introduced the You Fight Act with Senator Lummis and the Women's Heart Health Expansion Act with Senator Britt. Uterine fibroids affect up to 80% of women in this country. It is a subject that is still often not openly discussed, or even one that the general public is widely aware of, forcing women to suffer in silence. That's because despite impacting 4 out of 5 women, uterine fibroids receive 0.03% of all NIH funding. While the cause of uterine fibroids is still unknown, fibroids are often painful and are the most frequent reason for hysterectomies. Women who have fibroids are also more likely to have problems during pregnancy and delivery, and both the condition and the treatment can lead to infertility. So many women have to be their own advocates to seek relief. Patients wait on average 3 to 6 years and see 2 or more healthcare providers before they receive a diagnosis, underscoring the need for improved awareness and education. S2531, the You Fight Act, would bring a welcome change to the current landscape, expanding access to early screening, detection, and intervention methods for individuals diagnosed with uterine fibroids. I'm proud to partner with Senator Lummis on this legislation and request that our committee consider it as a part of a bipartisan markup very soon. We also know that heart disease remains the leading cause of death for women across the country, from Maryland to Alabama. That's why I was pleased to be able to work closely with Senator Britt to introduce the Women's Heart Health Expansion Act, which would reauthorize the Wise Woman program at the CDC. Wise Woman provides free cardiovascular risk screenings to reduce the risk for heart health, for heart disease and stroke to lower income, uninsured, and underinsured women. The program provides critical funding to state departments of health and health consortiums from Alaska to Louisiana, but at current funding levels is not able to serve every state. Outdated restrictions are also limiting the population it can reach. This bill removes those barriers, expands providers, and authorizes $250 million to take life-saving prevention nationwide. Thank you.
That somebody was reacting to Angela Alsobrooks. So many women have to be their own advocates. You're a femme president, and some stuff that women aren't taken care of in this country. Let's look out for each other. We have a nice day. I'll talk to you later. Bye-bye.